Welcome to Pack Talk Podcast, episode 128. Today we're honored to have Dr. Jake with us today, and he is a veterinary cardiologist specialist, and he's got a very thick background of experience and everything he went through to get to where he's at today. So we're excited to learn about his background and also learn about how we can help our dogs or things to think about when it comes to our dogs and maybe other animals as far as heart disease and cardiovascular things go. So, Doc, thanks for being here. Thanks for joining us.
Thanks for the opportunity. Appreciate it.
Doc has taken care of two of my own dogs. You know, one was a little bit difficult. We had to wrestle him on the table.
Yeah, that's how we met.
No factor.
Was this Bane?
Yeah, Bane. Yeah. And the listeners, they know about Bane's story and everything, but Bane's good to go. He got taken care of by Doc. So,
nice.
Doc, born and raised in Charleston, South Carolina. You got any quick stories from what it was like growing up in Charleston? What got you to look into veterinary to begin with?
Yeah, it's changed quite a bit. I grew up here in the Low Country, and we had a lot of stray animals around the house that I grew up in. It was on the marsh. There was raccoons, there was cats, and so my mom was pretty interested in getting this trap and release program so you could kind of cut down on the number of stray animals. So it was basically, you know, if you had a weekday off or a weekend, trying to help her do that, take them to the local vet. And I don't know if you did this when you were in like elementary school, but there was like a shadow program where on Groundhog Day, you would go to shadow a profession that you were interested in. And so my dad's an attorney, and I did that one year, and that was terrible. It was just basically sitting, you know, watching my dad at a desk, like do paperwork. And I was like, okay, well, let's not do that again. So then my mom gave me the idea of like, okay, well, you always go to the vets to help them, like, you know, drop off these trap and release stray cats. And, you know, you've got a good relationship over there, so why don't you follow them around? And, yeah, I fell in love with it. It was so dynamic. Like the doctor was great too. So he was a good influence, a good positive influence, but, you know, taking an animal, doing blood work in the, you know, laboratory, and then heading back to the operating room and doing a spay, neuter, recovery. And it was just like a whirlwind of activity between the nurses, the doctors. And, yeah, I fell in love with it. So really from then on, I just, you know, when I had time to either volunteer over there or help them clean cages and work at their boarding facility, I just kept at it through high school, ultimately, when I went to Clemson for undergrad. And by then, I kind of knew that's something I wanted to do. So Clemson has a pre-vet program, which kind of fast tracks you into becoming a vet or getting the requirements you need to make you an eligible candidate for vet school. And that took me to Georgia. You want me to keep going through the bio?
So, so you went to your undergrad at Clemson. That's where you went next.
Right.
Real quick before we keep pressing on, when did you figure out about your specialty? Was that when
Not
you
yet. So that's
yet?
not until vet school a little bit later on that you kind of get more exposure. But so here I am, you know, growing up in Charleston. Now I'm at an agricultural school, Clemson.
Okay.
And the pre-vet program there is trying to prepare you for not just small animal, but like large animal. That's kind of the upstate's pretty rural compared to
cows,
some
horses,
of the, exactly.
all that.
So I was taking poultry classes, beef, dairy. I worked on a pig farm over a summer. And so I got kind of a deep dive into the agricultural part of veterinary medicine. And it's something that I appreciate the experience. I felt lost mostly doing it. I don't know how to like handle horses, and I was like scared of getting kicked, and you gotta, you know, stick your arm up to your shoulder into a cow's rectum, and you're like, your milking classes are, you know, when you milk dairy cattle, like those places get up and going at 4 a.m. And so when I was a freshman in college, your classes started, you know, before the sun was up. So it was a interesting, you know, college experience initially.
You had some of that fresh milk.
Yeah,
you had some fresh milk, dude.
no like RFK raw milk, but I'd be curious. So I got kind of the small animal aspect here, some large animal experience to kind of help round out my resume, I guess, for making me a little more competitive for Georgia. But Clemson was a great experience.
And so from there, you went to Georgia.
Yep. So there's no vet school in South Carolina. They're working on that now, but they have contract spots at Georgia for South Carolina students. And so you get selected for that, and you head to Georgia for vet school, which is 4 years, just like med school. Yeah.
So
Athens, Georgia.
So what's that kind of like, vet school, just a quick and easy on what that experience entails?
Sure. It was another good experience, a lot of learning, classroom and sort of clinical combination for 4 years, studying, kind of hammering a different language into your brain, learning all about medicine. And then towards the end of that is where I think I started to kind of fall in love with maybe the idea of becoming a specialist. When you come out of vet school, you're prepared to just become a practitioner, a general practitioner. If you go to, your local vet and you need a spay or neuter, vaccines, preventative, your wellness checks, you're equipped to do that. During your clinical year, you get a little taste of all the things that will make you a good vet moving forward, cardiology being one of them, but there's oncology, internal medicine, surgery, ophthalmology, dermatology. And so you kind of rotate through all these little different fields. And the course and the instructors and the parts of cardiology were really just interesting to me, to where I found myself either using, you get kind of opportunities to double down on certain clinics that you want to learn more about, or you can go travel and visit other hospitals and do the same thing. So I found myself gravitating towards cardiology. It was not set in stone, but it was something where I was like, okay, I kind of like this.
Yeah. And so when you finished at Georgia, you went to Colorado State University. Did you go straight there, or how was that kind of set
so
up?
Then you go through this match program that you do in human medicine as well, where you're like, okay, I want to kind of continue my education. I want to become an intern and learn more about all these disciplines again. It's kind of like a clinical year, but now you're a doctor, and it's a little more, you're going to be, if you're going to an academic institution, you're going to be the Marines. You're going to be the, front line of like, okay, if an emergency comes in, or if a case comes in through this specialty, you're going to go up there and with the students kind of collect information, and you're going to take a crack at it with some professors above you, some specialists above you.
Right.
So you do a lot. It's kind of just like repeating your senior year of vet school, but in a little more of a responsible, you've got a lot more responsibility in both teaching and kind of executing the decisions.
Yeah.
And a lot of that, actually, the first internship was emergency medicine. Like, there's no better way of kind of learning a lot other than like, taking a sip from a fire hydrant. Like, this was just like, emergency. So you had long hours and like just another kind of rinse of all these rotations. And again, kind of with the opportunity to kind of double down on cardiology when I could. So still just now a baby vet, learning more about cardiology and hanging out with the cardiology group a little bit more, but just getting a lot more expertise. And so then after that rotating internship is Colorado State, you then apply to a specialty internship. It's like, okay, now it is something I want to do, cardiology. I'm going to go to study with just a cardiologist and do just cardiology. So then that's where I went to Tampa, Florida, and studied with a cardiologist in a private practice setting, kind of like what I do now.
Okay.
But I was, he was my mentor.
Yeah.
Kind of taught me the ins and outs of kind of how the business part of it works, and how, prepping me for a residency, which is the next step of this journey.
Yeah. Before we continue on, going back to Colorado, for those that haven't been out there, it's pretty beautiful out there. You got the mountains, you've got moose out there, you got some bears out there. Had you been to Colorado before you went out there for your internship, or was that your first time going out there?
Yeah, growing up, I would do some winter trips out to Colorado for skiing, so just short little trips, but nothing ever extended.
Yeah.
No wildlife experience there, but interestingly, the year before or after that, I'll end up in Tampa, where Busch Gardens is, and we, next to being like the vet clinic of Busch Gardens, we could get some exposure to anteaters. I think we echoed an anteater, a lion.
really?
So we got some like kind of fun field trips at that place.
Were those animals like sedated, or
Oh yeah, they were fully under anesthesia. So we would show up and like it was already taken care of. So like the on-site vet team, anesthesia team would take care of all that.
Okay.
But it's still cool to kind of like see those animals
Right.
up close.
Anteaters, those things got some big claws.
They've
on
got
them.
huge claws.
Yeah.
That's what I remember about them. Like
That's
they
their
are
danger to them, because
Yeah.
if they hit you with that, it's pretty. Can be lethal, I think.
Yeah.
Right?
Oh yeah, they're huge. It looks what I imagine. I haven't seen a bear claw like in real life up close, but it looks like what I imagine them being like, just huge daggers.
That's awesome.
Yeah.
That's awesome. And handling a lion, what's that like? I mean, I know it's asleep, but you gotta touch it and stuff, right?
It was asleep. I took a whisker for good luck. I don't know if that was bad luck, but yeah, it was fun.
That's super cool. So you did Colorado. You went to Tampa. Any alligators or anything down there?
No, I think I echoed a big boa one time. So there was snake. There were some interesting pets, but that was probably the most exotic exposure I got, just with Busch Gardens being nearby, and then just people of Florida tending to be kind of just owning a snake. Like
Wild.
that's Florida people.
For sure, dude. And so when you're doing this cardiology, obviously you're not just doing dogs. You're doing
It's cats and dogs mostly.
Okay.
I mean, there are people who work a lot on horses, but it's just in Charleston you're not going to get that sort. And then after Florida, I went up to Manhattan, so you even have just cats and dogs. I mean, if it's not can't ride on a subway to the hospital, then it's probably not going to end up in our clinic. So there are folks who practice cardiology and do some kind of non-cat dog work, but that's not me.
I got you.
Yeah.
So from Tampa, you went up to New York. What was that like?
Yeah, so that's your 3-year residency. So this is like, okay, at the end of this, you're going to have to take a test. And you're going to have to know every little thing about cardiology so that when you head out there, you're an expert in the field. And if anyone in your town or state has a question about this, you're going to be able to answer it. And so this was a, front to back dive into human cardiology, veterinary. I mean, a lot of the books we read were human cardiology textbooks, because a lot of the diseases are the same, but just everything from anatomy, cellular level, up to kind of diseases and how you manage those. And this is also where you start to get some surgical exposure. So when I think about cardiology and what kind of attracted me with it, there's probably 3 things. There's a tool that you get to play with. So we've got an ultrasound machine here behind us. So I'm constantly ultrasounding the heart, putting eyes on the heart. That's visualization. It's our video game part of the day. There's the kind of client and patient interaction. So you're going up there and you're talking to clients, meeting nice folks, being a part of their family care. Still getting to hang out with pets. I mean, that's a wonderful part of it, is like you get to see cute cats and dogs all day. I mean, that's a big bonus. And then there's the surgical aspect. And so when a pet is born with a congenital condition, they can be born with holes in their heart. They can be born with extra vessels, and you can surgically close those as a cardiologist. So you start to learn that technique. If a dog gets old and their electrical system starts to wear down, they get a pacemaker, just like a human would. And so now is where you start to get exposure to that. And you need kind of a bigger teaching hospital or teaching space to be able to do that with the equipment, the inventory. It's a lot.
Yeah. And you were there for 3 years doing your residency. I mean, that's a long time, but there's
3
a lot
years.
to learn and specialize in, right?
Agreed. Yeah. So every year you're just, you're kind of meeting this checklist of things that you think you need to accomplish to get to that final goal.
Yeah.
Getting a little more responsibility, getting a little less kind of, oversight from the attending cardiologist, and a little more on your own.
Gotcha.
Yeah.
And so up to this point, you've been through all these different schools, internships. How many years do you have under your belt of learning?
Yeah, I guess it depends on where you stop. So I guess after college is where I usually say it's 9 years. After college, it's 9 years to become a cardiologist. Really, whether you're human or veterinary, it's about 9 years.
Yeah. So that's a lot to learn, a lot going on with the body, whether it's an animal or a human body, right?
It went by fast, but it is, it's a different language, and if you need to kind of know everything a little about it, then it takes a while.
So when did you end up making the decision to come back to Charleston?
Kind of towards the end of my residency. So I was up in New York, and then, as you're round third, you got to figure out where you're going to practice. And it part of that has to do with like where there are positions that are open or places in need.
Mm-hmm.
And there just so happened to be kind of something opening up in Charleston, where I'm from here.
Mm-hmm.
I love it. I've traveled a lot. I always wanted to come back to Charleston. And so just clicked.
Yeah. Because I was wondering, like, whenever you're ready to move back, I didn't know if there was a cardiologist that was here already. You'd have to plug in with them, because obviously they probably dominate the area.
Right.
Because bringing in too many specialists into a certain geographical area could be a little bit of a problem.
Not
potential problem. Yeah, exactly.
Yeah, it lined up pretty well, where there was a hospital here in Charleston who had a cardiologist, good guy, who was heading back to his hometown, and they needed a fill in, so it just worked up perfect. Yeah, but you're right. I mean, overall there is a need for a lot of specialty care, in the country and elsewhere, but there are some places that are a little saturated, so you do have to think about it, but it worked out fine.
Well, the other thing too I think about with a lot of the veterinary specialists is, maybe 20 years ago, I don't know how many people were taking their dogs to a cardiologist.
Right.
Whereas today, people see their dog more as their family member. They're willing to do those kind of specialty cares. At least that's what I see where I'm at. I'm sure you see the same thing with all the people you're dealing with. But
yeah, it's evolved a ton. I think your people's want and ability to care for their pets beyond just kind of basic needs is really grown. And and with newer vets coming out, they also have kind of more interest in getting these clients who want that next level care into those specialists' hands, because it benefits the pet ultimately. If I'm working with your vet about their heart disease, then that dog's going to do better. You're going to get more client satisfaction. So newer vets are kind of quicker to get these cases to where they need to go from the get-go.
I got you.
Yeah.
I got you. So let's talk about heart disease. If you could give us kind of the underlying explanation of what is heart disease in dogs, or what are some major problems that you see as a cardiologist that a lot of dogs are dealing with.
Yeah, so a lot of the heart disease that we see are going to be acquired conditions. So I would probably just break it down into congenital conditions, things that you're born with from the get-go. Something didn't develop properly. Part of your heart didn't close right, or an extra vessel stayed open, or a valve didn't, seal up or doesn't open. Those are pretty rare. We see them, weekly, but they're not your everyday case. A lot of the stuff we were seeing are age-acquired conditions. So heart muscle disease and valvular disease are going to be the top of those things, whether it's cat or dog. A valve problem is, just like in a car or appliance, as those age, valves get wear and tear on them, and they're not going to make a perfect seal. And so there's 4 valves in the heart, just like us, and those valves can become affected. They start to leak, and that can cause a problem. And then cardiomyopathy is just a fancy word for heart muscle disease, cardiomyopathy. And just like, if you've got age-related conditions to any part of your body, whether it's your kidneys, your eyes, your joints, your heart's no different. It's a muscle, and it should just be a muscle. If you took a chunk of it and stuck it under a microscope, you should just see muscle cells. There's some conductive tissue too, but it's mostly myocytes. And you're going to have some normal age replacement of that, or some conditions that kind of accelerate that. And so cardiomyopathy is a condition where you're kind of replacing that heart muscle with things like fatty tissue, scar tissue, things that aren't going to pump well, relax well.
Right.
So those are the 2 big conditions we see day to day, are cardiomyopathy and valvular disease.
Because when most people think about heart disease with a dog, they probably think of the big term DCM.
DCM, okay.
Right? That's what most people are like, that's what heart disease is, but it's more than that, right? DCM
yeah, that is
one thing.
Right, that's a flavor of cardiomyopathy, but there are a few. So yeah, DCM is dilated cardiomyopathy, and if you've got a large breed dog, this this may sound familiar. Those are the breeds that are kind of at risk for DCM. And then there's also what kind of got DCM, I think, a little more fanfare is about 10 years ago, the introduction of a lot of grain-free diets kind of put fuel on the fire of the prevalence of DCM. And so we started seeing a lot of nutritional cardiomyopathy. So when you say DCM, really what you're looking at on the ultrasound is a heart that's just big, dilated, and not squeezing well. And you don't know the cause. I mean, there are some causes, whether it's just genetics or perhaps you're just robbing them of nutrients. I mean, if you're feeding them a diet that doesn't have essential amino acids that they need, then you can end up with a poorly functional heart. And so, DCM is a big one that probably maybe a lot of your listeners have heard of or have experience with.
Yeah, I think that's just like taken off in the past couple of years. People are talking about that all over the place, but people forget about all of the spectrum of heart disease.
Sure.
At least that's what my perspective is looking at it,
Yep.
Something else that people, that I don't know if this is considered heart disease or not, but heartworms.
Sure. Yeah, I guess that was a category that I didn't really think of. So congenital, acquired, and then there's this infectious category, right? Okay. So you go to, your vet every so often to get vaccines to, prevent viral conditions, and you give preventatives monthly to kind of prevent parasitic infections, and heartworm disease is one of those. So you give heartworm preventions every month to prevent this worm that mosquitoes can carry, this larva, from growing up, living inside of your dog's body, and becoming a real kind of havoc wreaker. Heartworm disease is something that, at least in the South, general practitioners have a huge exposure to and understanding of, and ability to kind of handle on their own. We'll see some kind of complicated cases of that, but for the most part, if you're a regular vet, you're testing for heartworm disease, you're prescribing preventative, and if you catch it early enough, you just kind of nip it in the bud.
There's like an injectable you can use to kill the
worms.
Right.
There's a whole society. The American Heartworm Society has a whole protocol, but there is a injection that you use, 3 injections to kill these parasites that are living in the bloodstream. Right,
because they have a different life cycle, right? If they lay eggs or something, you have to kill the new larva, the egg, and all that. So that's why it would be multiple injections.
Yeah, exactly. You kind of give the opportunity for, you kind of do a first sweep through, and then you give the dog a little bit of time for the ones that may not have been fully mature to kind of grow up a little bit longer, and then you do another sort of wham-bam shot to finish them off.
So when would that escalate to coming to you if they have a bad enough case?
Yeah, so heartworms, it's a little bit of a misnomer. So they actually live in the pulmonary arteries. So one of the sides of the heart pumps blood to your lungs, and these worms tend to live in the pulmonary arteries. But if that infection is long enough and bad enough, like untreated, and just there's such a heavy worm burden, they'll start clogging up the pipes. So if you've got worms that are in there, and I've got a jar in the other room.
Oh, really?
Big infestations are usually like 30 worms, and these are like pieces of spaghetti long worms. And so they'll clog up the pipes, they'll cross valves, and valves need to close. So if a valve can't physically close because it's, got worms like swimming across it, lingering across it, you'll start to get backing up of blood, fluids. You can go into heart failure from heartworm disease. So there's actually those guys are a little bit tricky. You can actually, open up your jugular vein, and sometimes the infestation is so big that the worms that are living in the pulmonary artery are kind of, out into the right heart, up into the jugular vein, because all your blood flows into your heart, right? So if you've got this congestion of these worms, the second you open into the jugular vein, sometimes those worms are just popping out ready to escape.
What?
And so you can just start taking forceps and pulling them out. And
you've seen this? You've done this?
Oh, yeah. So this is called caval syndrome.
Okay.
And you'll open up the jug, because if you just give them an injection and kill those worms, you're probably going to kill the dog. Because if you kill the worms and they're clogging the pipes, now all of a sudden you're just going to have those dead worms travel on down, block all the arteries, and that's game over.
So you're saying the worms want to get out because it's so congested?
Yeah, the worms,
What?
they don't really care much about the host. And so they're just, they're living in there, breeding, growing. But when you have an infestation that big, you have to kind of remove the large chunk of them before you give the injection so you don't hurt the patient. So you can remove them, sometimes again, the infestation's ready to pop. Otherwise, you kind of just create like this sterile catheter and spin it around like spaghetti and pull them on out. It's like fishing.
What the heck? Dude,
Yeah,
that's crazy.
yeah, it's nasty. It's nasty.
And how's the dog like? Obviously, you're cutting open their jugular.
Well, they're
right?
fine. I mean, you can, if you've got kind of like, sutures on either side of the jugular, you can control blood flow so they're not sitting there losing blood. But you're like, you lift this one up so you can control what's coming in and out. And then you kind of do your little spaghetti twirl, pull them out, and like you just keep plucking.
Dude, this
until,
is insane, dude.
Yeah. That's a wild one.
And the worms, like they will, like at least what I've heard, it might be a rumor because what you're saying is they're living in the arteries and everything. But I've heard they eat the heart and they like are going around. Is that myth?
Yeah, I don't think they're eating the heart, but they're not doing any favors. Yeah, they're clogging things up.
Right.
Yeah.
So people that are saying like we train a lot of dogs that have been, they've had heartworms, that they've recovered from them.
Right.
But then we think about like, hey, what is the exercise capacity of this dog? Yeah. So what? From your perspective, if a dog has been treated.
Sure. It kind of depends on how much damage was done so we get a lot of rescue dogs too in this area. And, it may have been that they had heartworm disease for 6 months and not a ton of damage was done. And their heart and lungs aren't, much worse for the wear. And they go on to live an unaffected life from it with regard to whatever activity. And so, but some dogs, if they've got it long enough, bad enough, you should not have a worm in your lung vessels, and it's going to really irritate the lung vessels. It's going to cause inflammation in the lung tissue. And so we'll see dogs who had they were treated when they were young, and now they're 8, 10, 12 years old. It's catching up with them. They're chronic coughers now because they've got, lungs that are a little bit scarred up from when they were younger. And they may need some respiratory therapy. It doesn't usually get them, but it's like something that needs to be managed as they get older. And yeah, sometimes it can affect, if your lungs aren't quite right, it can affect your exercise capacity. So it can have a factor down the road of how they do.
Yeah, so don't what we do is like if we have a dog with a history of heartworms, we don't if the dog seems to be tired or lagging, we don't push that dog. It's like, hey, let the dog rest.
That's a perfect way to look at it. I think with most dogs and heart disease, whether it's heartworm or otherwise, letting the patient kind of call their own shots or limit themselves is appropriate. Sometimes you get dogs who are just fools, and they you have to help them take breaks.
Right.
But for the most part, if they need to quit, you help them.
Yeah.
You
they have a prey drive that overrides their capacity.
Yeah, you probably deal with a lot of that in the training arena.
Yeah. So the best way to prevent heart disease or the heartworms is just prevention. Preventatives.
It's as simple as that. There's some areas that are seeing some resistance to that, but these are like the Mississippi Delta areas that are.
Really? So the worms are still they're resistant to the preventative, is what you're saying.
Yeah, there's some of that, so that's never good. But
I know with chickens, it's important to rotate your wormer because the parasite load on a chicken, the worms will get used to it. So I rotate wormers every 6 months for my chickens, and peacocks are super sensitive. Not to go off on a bird tangent, but
no, I like the bird
Doc
tangent.
here just got chickens for the listeners. So.
Tell me more. Let's do a tangent. So do you put that in the dust bath sort of?
I put it in their water.
Okay, so it's a ingested one.
Yeah, so I put it in their water, and then I will get a pelletized one to put in with their food.
Okay.
Sometimes because my chickens are free range, so if it rains, they're drinking water out of a little puddle somewhere.
Yeah, that makes sense.
But I have their water bowls that they normally drink out of, so I can put the wormer in there and understand that most likely they're ingesting all of that,
So they're getting parasites. If you weren't doing that, where are they picking up parasites? Just in the yard,
in the ground. They're eating bugs off the ground. Their feed falls on the ground. They're eating that. That kind of stuff is mainly where they get it. But peacocks, this is my first year having a peacock, and apparently they're more sensitive to worms, and chickens, apparently they can tolerate a lot of parasites and still be fine. Peacocks are more sensitive. So the peacock experts that I talk to, they're like, hey, you got to worm them every 6 months. You have to be on it. If you're not on it, you'll notice a decline in their health. And if you're not fast enough to respond, you could lose the peacock because of the worm load. So,
wow.
You know, birds, they're crazy. But,
Yeah.
But yeah. So I was just wondering about what the dogs, I didn't know if it was the same thing to rotate wormers or anything.
Yeah, it might not be a bad idea in areas that are experiencing that sort of resistance, but otherwise I think whatever your vet, you know, the preventative of the day that your vet prescribes, that stuff's always changing too.
Right.
There's new products coming out. I think there's even
They got a shot now.
Yeah,
I think.
exactly.
Yeah.
Like 6-month shot called ProHard that helps with compliance. So
Right.
yeah.
So that's good to go. So you talked about a couple things that causes heart disease. You know, I want to deep dive into that a little bit more if you can, about the myopathy side of it, where, you know, it from my understanding, the muscle tissue degrades, the heart enlarges, or it becomes like a fatty tissue. I know you said they need nutrition, they need amino acids.
Yep.
I'm assuming that's from like a protein source, right?
Yeah.
Or is that from other
yeah,
things?
exactly. So if you look at dilated cardiomyopathy, let's touch on the diet associated one first. So there are some dogs on some diets that are developing this condition. It's not super clear why, but it most likely has to do with the high concentration of legumes in some of these dog foods. So it used to be, you know, kind of this grain-free or boutique or exotic ingredient foods that we were worried about. What it really seems to be is peas and lentils in some dogs seems to prohibit the absorption of the protein part of the food. So yeah, there are amino acids that a dog cannot. Amino acids are building blocks of protein. So if you need to make a heart muscle, you need these building blocks, and you need to. If you can't make them, you need to ingest them. And so dogs these are essential amino acids that they need from their diet. And if your diet is preventing you from absorbing this from the food, then that's a real problem, and your heart could suffer. So some dogs on these legume-rich diets are experiencing, dilated cardiomyopathy, a heart that's too big, it's floppy, and they go into heart failure. And you switch their diet, and 6 months, 18 months later, that disease is gone. You take them off of meds. That is, that's really kind of been the sort of thing that we can help the most with in the past 10 years. I mean, it wasn't something that we noticed 20, 30 years ago. It was kind of when people started eating more gluten-free products. They want to feed their pets what they're eating. And so they're like, let me put my dog on some grain-free food. Yeah. And it kind of just became a big issue. So we're backpedaling a bit from it. Now, there's the other type of cardiomyopathy is one that you just really don't have much control over, and that's just genetics. Like there's mutations in genes that signal your heart muscle to just become a certain way, and those dogs end up with a heart that doesn't pump. And if your heart needs to pump blood forward and it's not squeezing all that blood forward, things start to back up. And if you get backing up of blood downstream, you can end up pushing water into your lungs, which is the complication of cardiomyopathy, heart failure. So we use medication to help with the heart performance. So dogs either don't go into heart failure, or you can delay heart failure. Yeah.
The medication helps the heart like pump and operate normally.
So if you've got a heart that doesn't pump very well, cartoonishly, you would want a drug that helps it squeeze harder. So if you've ever seen Popeye eat spinach and his muscles get strong, there's a drug out there that helps the heart muscle improve performance called Vetmedin or Pemobendin. And so, it's kind of like Popeye eating spinach for the dog heart.
Nice.
It's a good one.
To go. For the dogs with the nutritional myopathy, what do you generally recommend for those people?
Switch their food.
Yeah.
Switch their food and give it some time. And you still give them cardiac support until, medication until I mean, sometimes you don't know. I mean, if a dog comes in and it's been eating a certain diet for 4 years and you're seeing this, well, I'm going to treat it like it just has it, the run-of-the-mill DCM. And I'm also going to switch their food in case that was the culprit. And if you start to see that heart look better and better over time, you got your answer. It was a diet problem. But if you don't, you could, if you're an older dog and you are the type of breed that gets this, Doberman's probably the poster child, then you are, you're probably just dealing with run-of-the-mill DCM.
I got you.
Yeah.
Those genetics, they take time to affect a lot of dogs?
Yeah, it's a little bit different for every patient, just like, some folks will get arthritis really young, and some people they take their sweet time.
Yeah.
So yeah, it can happen, unfortunately, early in some patients, but
Gotcha.
For the most time, for most dogs, it's the typical average age is when they're older.
I got you. What if someone's sitting at the house, maybe they see something weird with their dog, they're wondering what's going on? Can you tell us some of the
Symptoms.
early things, if you're a pet owner just at home with your dog, some
Sure.
things maybe indicating there's a problem?
Yeah. This one's a little bit tricky because a lot of the symptoms that you see with heart disease tend to accompany pretty late stages of heart disease. So it doesn't mean that we shouldn't be looking for symptoms, but I think a lot of the patients that we get referred to us where we can intervene earlier, the better. Those have to do with what your vet is picking up on during a visit for either routine care or a different problem altogether. So when your vet is listening to your dog with their stethoscope, they're listening for murmurs, which is an abnormal heart sound, or an arrhythmia, which is an irregular heartbeat, or they're doing blood work and there's, just like liver tests, kidney tests, there's heart tests. And if they're getting a red flag in any of those arenas, then you can get screened for a heart problem. You get an ultrasound of your heart called an echo, and do you have heart disease, yes or no? And if so, what type and what stage, and what do we need to be doing? Now, if your heart disease advances to the point where you start to have symptoms, sometimes that happens and people pick up on it and they get seen. But yeah, exercise intolerance, it's pretty tricky. How do you know if your dog has experienced exercise intolerance, or they're just being lazy, or it's their joints, or it's just hot out? So that's a really tricky one that I think is hard as a pet owner, maybe even hard as to know about yourself. The other ones are respiratory signs. I mean, if you build up fluid in your lungs from a heart problem, which is what heart failure is, you're going to have respiratory signs. You're going to cough. You're going to have labored breathing. Now, that doesn't mean every dog coughing has a heart problem. Some dogs have coughing from airway issues, tracheal issues, bronchitis. So respiratory signs would be the biggest one. But ultimately, a lot of patients that get referred here early on are just from physical exam changes.
I got you.
Yeah.
I got you. And I'm assuming that you talk to a lot of local vets. Sure. Because a lot of vets might not know.
Sure.
Certain things. I don't know, like what blood markers you're looking for, if they're elevated or, too low. What are some things you typically tell vets to pay attention to and maybe call you if something's going on?
Yeah, we do that. A lot of what we do is educating, general practices about, we do continue education courses, or if they're, we're just like a lifeline for vets who have questions about an x-ray they took or an ECG that they ran or saw during anesthesia. And so they know where to reach out to if they see something unusual. But a lot of it's pretty straightforward. I mean, a lot of the vets who graduate vet school are pretty equipped to know, okay, this dog potentially has a heart problem. Let's get it into a cardiologist to get more information on it.
Gotcha.
It may not be a big deal, but better safe than sorry.
Gotcha.
Yeah.
Now, whenever they come here, let's say a dog comes here to see you and your team, what are some of the main tests that you're doing? You already talked about ultrasound.
Sure.
Whenever I brought Bane, we put him on the table. You're running a bunch of tests. You were telling me what you're doing, but it was just a lot of information.
Yeah.
But what are some of the common tests you do when you're first assessing a dog?
Yeah, so there's an ultrasound of the heart. It's called an echocardiogram. It's just the same technology that if a pregnant woman is getting an ultrasound of the fetus, same technology. You're using a probe against the body wall. This happens to be on the side of the chest, and you're visualizing the heart pumping in real time. So you're looking at the heart, blood flow in, out, looking at the heart size, function, wall thickness, valves, opening, closing. And so this helps you kind of get a sense of, what type of heart disease and how bad is it. Pretty simple. An electrocardiogram is also known as an ECG or EKG. So this helps us assess heart rate and rhythm. Is your heart rate slow, fast, normal? Do you have AV block? Do you have some sort of tachyarrhythmia? So this helps kind of assess the electrical system. Again, some dogs, as they get older, their electrical system winds down. Their heart rate gets really slow and they can start fainting. They need a pacemaker. Or maybe this dog's got cardiomyopathy and their heart rate is racing. They've got atrial fib, which is a common arrhythmia. They need a drug to slow that down. Those are the two big tests that most, that are what we do that most people otherwise can't. Blood pressure, I think, is an important one that we assess here. And then x-rays. X-ray is something that, most general practitioners have, but it's our tool to look into the lungs. So if you've got a heart problem, often ends up creating congestion in the lungs, pulmonary edema, and this is our tool for looking into the lungs. So an echo helps you look at the heart, and a chest x-ray can help you look at the lungs, and the combination of those are pretty valuable in assessing a dog's cardiorespiratory status.
Gotcha.
Yeah.
So that's a lot going on. How long does that normally take? Or
it doesn't take us that long. We're pretty efficient. So, I mean, like when this is all you do, all your team, you're ready. We prep for the day. And so we know everything about the patient coming in from their vet. So we know the right questions to ask the client. It's not like we're just starting from scratch. And we know with the handful of tests what we need to kind of get the information to start a treatment plan. And so that can take an hour just from like, okay, let's get these tests done. It's not like human medicine where, I do the ultrasounds, I measure or interpret the ultrasounds, and I go up and talk to the client about the ultrasound. In human medicine, you'll get someone that captures it, and then you head out of that office, and then they send it off to a cardiologist, and maybe a week later they call you. And then maybe you go in there to sit down and talk about the results. So it just
takes a lot longer on the human side.
Yeah, it's pretty streamlined here. So a lot of people appreciate, like, you're doing that today? I'm going to know today?
Yeah.
We're going to start. Yeah, so it's just like, what do you got? What do we need to do?
Yeah. And one thing I was thinking of as you were talking about, because you keep talking about the electrical side of the body, right? Is that driven from the spine? Is that driven from the brain? Does chiropractic come into play at all to keep that spine alignment good?
Yeah. So there's a pacemaker in the heart. There's a node of electrical tissue that lives in the heart. Now, other parts of the body can stimulate it or help it relax, but there is a specialized set of electrical cells in the heart. And there's an electrical highway that starts and it travels throughout the heart. These are very special heart electrical cells. There's a different sort of electrical system in the body that deals with, a nerve traveling from your brain to your foot to tell you to move and back, or like you stubbed your toe, let's send some receptors up to the brain to tell you it hurts. These are different conductive cells. Okay. So they are kind of just for the heart, within the heart, and there's a sort of special organization in which they conduct electricity. Now, there are external things that can change that. Like, if you eat a big meal, you've probably heard of rest and digest. If you eat a big meal, all your blood goes to your gut, your heart rate's going to slow down, you're going to get ready to kind of take a nap. Or if a lion walks in the room right now, we would get a surge of adrenaline from our adrenal glands, and those would stimulate these electrical cells to speed up so that we would have blood flowing or jump out that window. And so there are external factors to consider, but when I talk about electricity of the heart, it is really just kind of starts and stops there.
Gotcha. Okay, makes sense. So if you got someone at home, maybe their dog has some type of heart disease, what are your general recommendations for them as far as caring for a dog that's having heart disease? Maybe it's a mild case, maybe it's a more serious case.
Sure. Yeah, I think nutrition's a good one. I mean, that's one that I have a lot of like personal interest for myself. It's a lever you can pull to try to make you feel better, live longer. So, and I think a lot of people want that for their pets too. They want to do the best they can. So when you have heart disease, just kind of a blanket statement is just watch your sodium. I mean, this happens in people, happens in pets. Sodium makes you thirsty, you drink more water. And if you've got a bad heart, you can't really deal with a lot of extra water. You're already pumping around too much volume. So salt restriction is helpful. Fish oil is one that's pretty nice. So it's got a lot of benefits, whether it's, dermatologic or orthopedic, for joint disease, skin. But it can help with the heart too. I mean, any sort of antioxidant's good when you've got a diseased system.
Real quick on the
Yes,
fish
sir.
oil, do you recommend your clients, do you recommend they put fish oil in the food, or do you recommend feed them fish, like a whole fish or something?
Yeah, that's a good question. So I don't know how much fish you would have to eat on a regular basis to
get
achieve the amount of omegas. So like I take a supplement just so I know I'm getting it, as opposed, even though I eat fish, I'm not sure I'm eating the amount that I need to kind of get to that level.
Gotcha.
So there are doggy fish oil products out there, and I think as long as you find kind of a reputable, well-reviewed one, that's probably the safest way. But
What if you use like a human grade fish oil?
That's fine. That's fine. Same stuff.
Yeah.
So I think it's just a good kind of supplement, whether it's people or pets, to have. Yeah, you can use a human one. That sounds great.
Because some of the things I look at is like they make these doggy versions of supplements like salmon oil or fish oil. I'm looking at it. I'm looking at the human. I'm like, it's the same thing. They're just marketing it a different way to charge more.
It's absolutely true. Yeah. So it could be a delivery technique. I mean, maybe the doggy one has got like a beef flavored capsule that your eye would be like, that's gross. Or maybe it's a pump that you can like just stick on their dog food, whereas we wouldn't really want to just pump fish oil into our mouth. So, but yeah, otherwise, if you've got like a good, if you've got a good source that you're using for yourself, there's no reason why you couldn't use that for a dog.
Nutritionally, what do you normally recommend your people? I know you said low sodium.
Yeah, so fish oil, low sodium. There are heart diets out there. There are the 3 big companies that make cardio specific diets, but they're kind of hitting these points anyway. They've got omegas in them. They've got the essential amino acids we kind of touched on earlier. They're inherently low in sodium. So I think if you just feed a good whatever dog food they really enjoy, fish oil, low sodium. I like also to have a protein bullet point in that part of the discussion. So if you think about the heart, it's a muscle, and the fuel source it uses is protein. So if you have lean, unseasoned protein, that's a good sort of way to supplement their dog food. So chicken, burger, turkey, eggs, fish, all those are really good protein sources.
Right. So if you make some ground beef, give some to your dog.
Absolutely. Yeah. Just don't, if you're seasoning it for yourself, just be careful of that part. The lean part isn't really so much for cardiovascular disease. So we touched on this earlier. It doesn't seem, before the podcast we were mentioning, it doesn't seem like dogs are that affected by fat when it comes to atherosclerosis, building up plaque, clogging vessels. They tend to process lipids a little bit differently, and they don't tend to get heart attacks. I mean, that's what a heart attack is when these coronary arteries get clogged up by fats, lipids, plaques, and they don't tend to get that. So the lean part of the protein aspect is really just for their gut. If you feed a dog a lot of fat, it can sometimes give them pancreatitis or an upset stomach. So lean, unseasoned protein. The last thing I would say is probably a heart supplement. So this would maybe be like a heart multivitamin, just to make sure that they're getting, if you've got heart disease and you're burning through substrates, these cellular mechanisms need little different micro ingredients to keep these processes going. And if you've got a heart condition, you might be burning through those quicker. This is where you don't really know. But if you can supply those ingredients, you'll never be without, and maybe that machinery keeps working more efficiently.
You got a heart supplement you like?
Not a particular brand recommendation. Yeah, I should get one and get sponsored here.
There you go.
Let me know.
But it's like a dog. It's like a dog supplement, right? It's
dog heart supplement.
It's not a human grade one.
You probably could.
Might do the same thing.
Yeah, I mean, I think the ingredients are the same. Yeah. Why not?
Because I know me personally, I have like a gene where my body has elevated ApoB, elevated LP(a), saturated fat. If I eat too much, it freaking, my lipids go through the roof. So I have to.
What is this gene? I feel like I tested myself. Is this the methylase one?
I haven't done that one yet. That's on my list, but it's a ApoE4 or something like that. One of those. But it basically tells you like, hey, are you
at risk?
Right. Does your body like not process lipids as good, or does your
Okay.
body efficient at lipids? So
So do you go on a statin the second you hear about that, or?
well, my ApoB is elevated. That's the marker that they look at. I'm a big Peter Attia guy.
Yeah,
so
that's
like,
where I know.
Yes, that's the marker that we look at for your risk of heart disease in the future, right? And we
Okay.
want to be below 60 as far as humans go. And so for me, what I did at first was I just switched to lean meat.
Okay.
Instead of eating fatty meat. That brought it down. I think my ApoB started out at like 98.
Okay.
You want to get it to like below 60. So I'm like, holy, I got a lot of work to do.
Yeah.
So cut out the heavy fat, eating lean meat. That brought it down a little bit. Made sure I get 7 to 9 hours of sleep a night. That brought it down a little bit. Focusing on zone 2 cardio and VO2 max brought it down. But I had to go on ezetimibe and rovastatin, just low dose, to get below 60. So I'm on ezetimibe and rovastatin. Ezetimibe, I think, is 5 milligrams. Rovastatin is 10 milligrams a day. And that keeps me below 60. I'm pushing to get to 30 or 40 right now.
Okay.
But, my genetics, they just blessed me with that where I have to fight that hard for it.
Right.
My wife just got her blood work done for the first time. Her ApoB, just without doing anything, is 50.
Yeah.
So
So some people are just lucky like
yeah,
that, right?
you got the genetics that.
How long ago did you get that?
I
figured
started
out?
my blood work probably 2 years ago.
Okay.
Looking into it, and I use a company called Merrick Health, which is
Yeah.
telehealth.
Yeah, I used that one time. You
use
just
them?
you order whatever you want.
Yeah.
And you go to the lab.
LabCorp.
And,
Yeah. So, been doing that, like it, but it's very interesting because for me personally, I like doing like muscle building phases, fat loss phases. As soon as I go into a muscle building phase, my calories go up. I have to fight a little bit harder to keep that ApoB down.
I bet.
Yeah. So muscle gain phase, fat loss phase, if I cycle those, then I keep it pretty steady.
Okay.
So,
And do you yeah, that's impressive.
what do you do for yourself?
I got mine tested one time. Maybe it was a couple years ago now, where I was kind of interested. At the same time, all those discussions, whether it was Attia Huberman or I think Gary Brecka was out there even mentioning there's these genetic predispositions. So I did kind of a small genetic roundup, and then also just some comprehensive stuff, CBC chem and some hormone levels, and just wanted to kind of see where I was at. I think it was after a month of being on carnivore too.
Oh, really?
And so I was actually kind of shocked with how fine my blood work was.
Oh,
I mean,
really?
most of the people that you tell, I don't do this. I maybe do it I did it half of January this year, but most people, if you tell them that's all you're going to do for a month, they're going to be like, you're going to have a heart attack. You're going to die.
Right.
I don't think that's necessarily true. I don't think it's so
No,
bad
I
for
don't
you.
think so. Yeah.
Yeah.
Is that how you eat, or how do you eat now?
No,
mostly?
normally, now I go through cycles too, where I'm like, I should probably be a little more attentive, but keto-esque, trying to just be careful with the amount of carbs, but pizza's good.
Yeah. Oh, I love pizza. Dude. I love pizza. It's easy too. If you got a long day, you're like, just throw a pizza in real quick. We're good to go.
Yeah. So try to eat healthy,
Right.
but it escapes you. You got to have fun every once in a while. But
You also don't want to be so strict to where it's like you're not enjoying yourself.
Yeah.
I enjoy my healthy eating. I follow the vertical diet most of the time.
Okay, tell me about that.
one. It's basically your protein source is like a red meat because of the all the nutrients inside of that. Recommend salmon and eggs, and then chicken is like a secondary if you can't get one of those higher nutrient dense foods.
Okay.
But it's got to be lean red meat, so like top sirloin, 96.4 ground beef, these kind of things. And then spinach, bell peppers, fruit. It's like a well-rounded, focused on micronutrients. And then if the rest of your calories, let's say you need more calories because you're trying to gain muscle, you can add in white rice as a carbohydrate source. It's supposed to be easy digesting, easy on your body. And you can use that to add in the other calories that you need for muscle building.
Yeah.
And then if you're fat loss, you just cut the white rice down. But you keep all your micronutrients in there, like your carrots and your spinach and your bell peppers. So
nice.
I can send you a copy of the book, man. It'd be
Is it called the vertical diet?
The vertical diet, yeah.
Okay.
They talk about sleep too, and exercise and
Sleep is
walking
huge.
after you eat. Yep.
Yeah, that's a
Because the first time I did a blood test, I was sleeping 6 hours a night. My testosterone was in the tank.
that's a huge part of it's a hormone disruptor if you're not sleeping well.
Yeah. So then
And then
I
you
got
don't want to
7
work out, and so it's just
Yeah.
cyclical. You don't feel well. You want to eat like crap. So sleep is probably get that in order. Were you having
Right.
sleep problems?
No, I mean, whenever I was in the Navy, I had sleep insomnia. Whenever I got out of the Navy, it stopped.
Stress, maybe.
But but what I used to do when I was younger was I just like sleep when I'm dead, and I'd wake up early, go to the gym, no matter how many hours I got. Whereas today, if I don't get 7 hours at least, I'm not working out that morning. I'll take the morning off, make sure I get the sleep. It's more important, you know.
Yeah.
But super interesting, and so a lot of that I do myself, I have tried to apply to my dogs. I don't know how much it translates to them, but I feel like it helps them at least some, you know.
Yeah, most pets don't have a problem sleeping. They're lucky.
Right.
Yeah, I'm sure
pet dogs are sleeping 80% of their day in most people's houses.
Yeah,
you know?
they're getting that. They're checking that box.
Right. But as far as the cardio, like what I used to do with my dogs back in the day, just intensive exercise every single day.
Yeah, I think that's good. Yeah, you mentioned Zone 2 and your VO2 max.
Mm-hmm.
Yeah, that's probably the way most animals should be.
Mm-hmm.
Is just like kind of this low grade, grueling activity that you're Zone 2 for a certain amount of time, just to kind of keep up your stamina. Then every once in a while, test the system and do some Zone 5 and try to get your heart rate up and all the blood flowing.
Right.
Yeah, I think that works. So, I mean, with heart disease patients, people or pets, I think there are some like realistic limitations to what they're going to be able to do. We definitely have pets who they'll faint. If their owner comes home and they're really excited, or the mailman rings the doorbell and they start barking, like we have pets with heart disease who just can't meet the demand in the moment with the supply they've got, and they'll lose consciousness. So some pets you have to be a little bit careful with, but the majority of our pets were like, okay, green light to activity, let them limit their own, want and need on that front.
Yeah.
And but don't stop them. Don't make them live in a bubble. I think it's still helpful and healthy for them to do that.
Got to get outside. Got to walk.
Yeah.
As long as that dog can walk or whatever.
Yeah.
Your dogs, what do you typically feed them?
Yeah, so I used to have, my last dog was a Chihuahua. He lived till he was like 18, and that was a couple of years ago, but he had heart disease towards the end for the last few years of his life. He was a Chihuahua, so he got picky. Little dogs, having a dog with a good appetite is highly helpful because one, if they ever need medicine, you're it's not going to be a problem. Some dogs would just eat it right out of the bowl.
Right.
And like having a body weight buffer is nice too. Like a lot of meds can make you feel kind of, low appetite and so he just ate chicken and rice for the last few years of his life. He didn't have any teeth. I mean, so I don't really have a dog nutrition personal experience that it was really helpful for this moment. But
you don't want them getting too skinny either, right?
Yeah, you don't want to get. I do not like them to get too skinny for the reason that, like, when the bad days are coming and you're going to go on a hunger strike, or if your kidneys are hurting and you don't want to feel good, you need a body buffer there. So slightly over-conditioned is what I would prefer to see some of my patients than the skinny ones, where they're going to lose weight quick. We call it cachexia. So if you lose muscle mass if you have heart disease, it's not undifferent than cancer. So people with cancer, their metabolic thermostat gets cranked up, so they're burning through fuel quicker. And if you aren't paying attention to that, it's hard to, play catch up. So kind of staying on top of it so you don't lose too much muscle mass and body weight is important.
Yeah. And so I try to, because I think it applies to us too. If as we age, it's harder for us to retain or build muscle, right? So it's like when we're younger, we need to have as much muscle as possible for when that time comes.
Sure.
So I think about with dogs too. If we have a dog, when they're younger, can we put more muscle on them? Well, dog can't weight lift like we can. It can't bench press or whatever. So some things I recommended to people, like, hey, put a doggy backpack on them when you take your daily walk and let them walk with a little bit of weight. You've obviously probably seen some of those videos where they got the pit bulls pulling the sleds and those dogs are jacked.
Yeah. Yeah.
Is there other things you like to recommend to people, like maybe to help put some muscle on the dog?
That's a good idea. I hadn't actually thought about that. I think I would probably have to, I think it's probably the client. It takes probably a particular client where you'd be like, okay, if you really want to do this, then maybe listen to someone with your expertise. You got to worry about making that recommendation and someone putting 100 pounds on a dog's back and now they got arthritis and they can't walk.
Right.
So yeah, that would be nice to kind of complement their routine with something like that. I haven't had a client who asked me that, but like for a client like you, where you were interested in that, I'd be like, yeah, that sounds like a good idea. Work your way, like start slow, work your way up. And by all means, try to do that.
Obviously, when the dog's walking, it's going to be inducing some muscle building, probably depending on the difficulty of that walk. Or if you have your dog sprinting, like playing fetch, that's going to build some muscle too. But
yeah,
it's something a lot of people probably don't think about as their dog is young and getting, through that prime in their life. Stay on top of that health, make them as healthy as possible,
Yeah, that might be the good time to pack on some muscle.
Yeah, exactly. Because there are a lot of people out there that, they live busy lives. So they go to work, they come home, they're like, we're not walking today because I'm exhausted, and that dog's like, I'm ready to walk. It's like, hey, the longer you do that, the more often you do that, the more you're putting muscle at risk of being lost. And then you develop some fat on that dog. And then the dog gets overweight, which is like a common problem in today's world where the dog's overweight.
That's not gonna
help anything.
Yeah.
Yeah.
You start to kind of add up all these things that you should be doing, ought to be doing. And you made a good point. Like if you have a person who's not even taking care of themselves, like what are the chances that you're going to get home and like, okay, where's my dog's weight training at today? Let me put this in the vest. And you got to have, if you had 100 hours in a day, all these things would be much easier.
Right. Yeah, I try to make things as simple. I'm sure you do with your clients as too. I'm like, hey, we have to figure out the best way to incorporate what you're trying to reach, at least on our side, training and behavior, in your daily routine. We're not trying to tax you with a bunch of things to do during the day.
Because they'll never do it.
Exactly. It needs to be as easily incorporated in what your routine is as possible. Because everybody's busy,
Yeah.
And in today's world too, everybody's they're switching to the next thing rapidly.
Right.
They get bored. They're on their phone. They're switching from one thing to the next thing, which is the way society is right now. But how can we incorporate them taking care of their dog to the best extent possible into their, routine that they like to do? You know? So, and then the other thing too is for us at least, we got people, they get this super energetic dog. Maybe they like a more sedentary lifestyle. It's like, hey, we need to select a dog that works for your lifestyle too, right?
Yeah, that mismatch can be a problem.
Exactly.
Yeah. Have you found where in your training experience where you had to be like, this matchup doesn't work? You need to...
Yeah, we recommend it we've had a handful of people that we have said like, hey, it might be best to find a dog that's more suitable for you. And my most memorable one is I had this elderly lady. She's passed away now. Super nice lady from New York, moved down here, got a little like a miniature doodle puppy. And this puppy was hyperactive, just genetically, got the Energizer Bunny all day. She did the training with me and everything, and then I'd tell her like, hey, we got to get you walking, and she couldn't walk that well.
Yeah.
We got to figure, and I was like, let's play fetching in your house. Let's do little things to try and control this energy. And she would call me complaining, he's too hyper. And so I went over there. I was like, hey, maybe we need to think about getting a dog more suitable for you.
Yeah,
a
pug.
She got upset. She's like, this is my dog. And I'm like, I get it. So
yeah, that's a hard.
But what she ended up doing was just dropping the dog off at daycare a couple days a week to help it like socialize and play, and that worked for her.
That's good.
But that's
I like the water aerobics. Seems like a good idea. I wish there was more ways to incorporate that into dog lifestyles, people lifestyles easier.
You're talking about like swimming and stuff like that? Yeah.
Those are so good.
There's one pool in the area, one doggy pool. You can book a session. You can go. You can let your dog swim or do swim lessons. But there's not a lot of public areas that dogs can swim at around here, unfortunately. You have to go up to Lake Moultrie up in Monk's Corner.
Okay.
Or down to, I think, the James Island County Park Dog Park has a little lake in it. But that's a difficult thing.
That might be a niche market that someone could hop into. It's just some doggy water training.
Hey, you got some space right behind your building right here, dude. Throw up a pool, you're good.
A doggy pool back there. Chickens and dog pools.
Exactly. So moving back to some heart disease stuff, what are some new and exciting treatments that you see coming up in the future for doggy heart disease?
Maybe, I'm not on the cutting edge anymore. I kind of, when you leave teaching hospitals, you kind of just leave a little bit of that behind. but I think gene therapy is kind of interesting. Like if you can give an injection of whatever drug you might need to alter this gene, that would be nice. Gene deletion. I'm kind of curious where that takes us.
That's in testing right now, or they're working on it right now?
Yeah, I think there's a gene. I think NC State had something where they were looking at dogs with DCM and just doing IV gene therapy, and I'm not quite sure of the results of it, but yeah, so that'd be nice.
You could look at that dog early in its life, see that it has a gene.
Yeah.
Do the treatment on it to eliminate that gene or modify that gene.
Yeah. But the problem with a lot of diseases is there's multiple genes that lead to that condition. And so sometimes affecting one doesn't always get you the outcome you want. And sometimes with genes, they, affect multiple things. So you may be helping A, but affecting B, which was unintentional. So that's kind of the complicated part of gene manipulation. Any which way.
That's what I was thinking is like, what else does it affect?
Yeah.
Or what's the long-term effect on the dog or the person? I know they're trying to do it with people now and everything.
Yeah, right. Like if you tried to, make your child highly intelligent, but in the process you make them infertile, like that's not really a great sort of side effect there. So gene, and then more targeted therapy. So, if you've got a drug like the drug we mentioned earlier that helps dogs with DCM, helps their heart squeeze harder. I think that would be nice to have more kind of targeted drugs like that. What that drug will do is if you've got some residual myocytes, some heart muscle left, it's going to stimulate that to work harder. It's not going to do anything for the fat tissue, scar tissue that's built up in the heart. So if there's like more potent drugs for that condition, that would be nice.
Yeah.
But I'm not quite sure.
Yeah. Well, I'm sure they're always working on new things and looking ahead. Are you familiar with peptides?
Yeah, I've from a personal experience. Is there dog ones that?
That's what I was wondering. I know that BPC 157 was originally tested on dogs, right?
Oh, was it? Okay, I don't know.
Sure. I don't know if it affects the heart or not.
I tried that I tried that myself, actually.
Did you?
Got some from, I don't even remember where. It's kind of silly to say, but I couldn't tell if it was a bit of a placebo effect, and it was kind of weird giving myself, injections of some reconstituted mystery drug.
Right.
And so,
Might be some trin in there too. You never know.
Do I look like I've done that? If I did that and this is the way I look, I think we would definitely know I got a bad batch. I like the idea of all that stuff. I mean, I think, what's one that's highly helpful that's a problem with the FDA? Look, the FDA is great. I mean, you don't want to have people selling poisonous products, but I mean, stem cell therapy and peptides like that. It would be nice if they made that stuff at least easier to study, for people and pets.
Yeah, I'm a big peptide guy. I tore my ACL last year.
Okay, so you had a good experience with it?
Well, Merrick Health, I'm one of their patients still, and they were like, hey, you've got these options.
Right.
BPC 157, TB 500, GHKCU. So I was like, hey, I'll try it, Sure. So I started injecting right at my knee, and I do think it helped with my range of motion because I go to physical therapy, and they're like, wow, you're way ahead of schedule. I'm like, I guess I just got good genetics,
So was it a combo peptide or two different ones?
I started off with different ones,
right,
and then I ended up getting a combo of the BPC and the TB.
From Merrick Health?
I originally would get it from Merrick Health, but then I know a guy that works at a peptide manufacturer.
Okay.
And he's like, I'll hook you up. And I'm like, cool. So I started getting them from him, You
just got like tiny little hypodermic needles and put it sub-Q next to the site of
injury. I hate injecting, so I got like the tiniest needle. I can't even feel it. I'll stick it in there and inject. But I did that. And then there's a new therapy called shockwave therapy. I don't know if you've heard about this, but basically it's like a device. You hold it to whatever site that you're working on, and it induces little shocks into that site, and so it basically creates little tiny micro damages, and then your body's like obviously more triggering to put blood there and resources.
Cool. Do you feel it?
Oh, yeah.
Okay.
Oh, yeah. And so I would inject peptide, wait a couple minutes, do shockwave twice a week. And as soon as I did the shockwave, the recovery just went insane.
That's cool. Yeah, I
So-
wish there was I don't have enough time to kind of dabble in that stuff, but if there was like a alternative medicine doctor in Charleston for pets, I think they could, really do pretty well, because
for sure.
that sort of thing, like when you think about acupuncture, chiropractor, like there's not really a veterinary option for that here in Charleston where you can do all those sort of.
At one place.
Yeah.
Yeah.
I mean, it'd be really
I
nice.
have a doggy chiropractor that adjusts my dogs.
Oh, in Charleston?
Yep. I can send you his info.
Okay.
I know 2 of them. I trained a dog for one of them, and the other one I've been using for years. He comes out to my place.
Yeah, I think
Dr. Rob is his name.
Okay.
I forgot the name of his practice, but
Yeah, I've seen the videos of that.
Yeah.
Of some guy. He looked like a big Russian-looking fella, but like it.
he's a little crazy. Dr. Rob, he's a little crazy, but
Okay.
you got to be crazy because he's doing Bane, and Bane does not like being touched.
I bet.
And so I got the muzzle on Bane. I'm holding his head. The dude's adjusting him like.
And
he's
does
like,
Bane react in a way you're like that he seems like?
Oh, the first time this is an interesting story. Had the muzzle on Bane. I'm holding his head. Doc is working his way from his butt all the way up to his neck. And at a certain point, Bane just got so pissed he ripped away from me and headbutted the guy, and the guy fell back. And I was like, Bane, come. I called him back to me, and the guy's like, oh, my gosh.
Oh, no.
And I was like, are you good, Doc? He's like, we still got more to do. And I was
Oh,
like,
my
all right.
God.
So got back into position. He finished the adjustment. But ever since that, Bane is he's growled at him a couple times, but he's tolerant of him.
Okay.
Doing his whole back. But
Okay.
it makes a big difference because
What do you notice that makes you say that?
I'll notice like several years ago, Bane was probably 2 or 3 years old. I did a lot of protection training with him. So hard hitting, biting, getting thrown around. We were training some police dogs back then, so we'd use Bane too as a way to train. And that messed up one of his hips because all that heavy work. One day I remember him waking up and he was limping differently, and I was like, I messed this dog up,
Yeah.
Took him in to check it out, and they said, hey, he's got a little bit of a hip injury with his back. And so that's how I originally got into chiropractic, because I was like, well, I need to fix his back or help him fix his back. So that's when we got into chiropractic. And as soon as he gets adjusted, within like 24 hours, he walks with no limp or anything.
Oh, wow.
And so I have him just come out every 6 weeks right now, just because if I wait till 8 weeks, I can tell there's a little bit of a limp there, and I can tell, okay, he's in pain, right?
Okay.
He's kind of out of whack or whatever. So, and he doesn't do any of that training anymore. He's mainly just zone 2, a little bit of high intensity, but he likes to play with some of our other dogs. And so, he gets rough and rolls around and all that. So that's going to misalign you,
Yeah.
But yeah, so it definitely helps him because after that adjustment,
His gait's good.
oh yeah,
that's
yeah,
good.
You can tell. So I'm a big believer in it, obviously, but I wanted to do a deep dive on peptides for dogs, and I tried to look up a bunch of papers and research.
Yeah.
Like, how much would you inject into a dog? Is it still site specific? How would it work on hips and spines and things like that?
Did you see anything out there?
I just haven't taken the time to really deep dive. I did like a easy overview. I couldn't really find stuff, but I know that it was originally tested on dogs.
Okay, I didn't even realize
PPC.
PP. Yeah.
Yeah.
That's expensive. It's expensive too.
Yeah, it can be for
Yeah.
sure. So, but yeah, I like that kind of stuff.
Oh, yeah.
Looking into those kind of things.
Yeah,
and-
attacking from all angles
Yeah.
should be the way. I mean, just one approach isn't enough nowadays.
For sure.
Yeah.
So, well, Doc, appreciate your time. You have any closing thoughts or
No, thank you. This is fun. This is my first. You got a professional
first podcast?
sort of. Yeah, this is my
Okay.
first podcast.
Awesome.
It is very, very well run. I appreciate the opportunity, and
Yeah, we thank you very much for coming on and
Yeah.
obviously taking care of our dogs.
Yeah.
Because I know Sarabi, our little dog, she's got her visit coming up here pretty soon with you guys. One question I do have, when
Sure.
I was doing Bane's visit with you, I know you did the ultrasound, the EKG, and all that. You mentioned some kind of harness that he could wear for 24 hours. What is that?
it's called a Holter monitor, and it just measures your electrical activity for an extended period of time. So 24 hours, 48 hours. Some people will wear them for a week or two. But basically, if you have a dog that you're trying to assess their arrhythmia burden, like what is their heart rate and rhythm doing, more than just the hour that they're here. So you get a sense of, are you seeing the tip of the iceberg here and it's really wild at home, or perhaps the opposite? Are they just kind of aggravated here because they're in a foreign environment? A Holter kind of clears that up. It tells you what's happening with the electrical activity when you're otherwise not looking.
Yeah. You usually recommend that for people that are doing a visit, or if you see something that's alarming.
Something that you need to get more info on.
Yeah. And so they just wear it for 24 hours. You take it off, you get the data from that, and then you can assess it.
Yeah, I mean, if you've got 100,000 beats in a day, I mean, how many of these are normal? And if you've got a bunch that are abnormal, are they sporadic? One every 5 minutes abnormal, or is it just like strings of abnormal? And if you have patients with bad arrhythmias, you can faint or have some sort of lethal consequence. So, getting them on meds based on what you're seeing there is kind of the goal. Yeah.
So the fainting goats, is that that they're having that problem?
I don't think that's an arrhythmia. I want to say that's like some electrolyte kind of disturbance that locks up their muscles, and I don't think they're losing consciousness. I think it's just kind of like a muscle stiffness, and they just tip over. But I could be wrong.
Have you ever seen one before?
Not in real life, but I've seen the videos. It's pretty funny.
Yeah,
because you like scare them, you startle them, and then they get like kind of locked up and they fall over. Yeah.
You ever seen any goats for cardio stuff?
I've never treated any goats. No. They would be a good patient though, because I bet medicating them is really simple. They like eat clothes. I'm sure they would take their meds. They'd probably be
for sure, dude.
compliant on that front. Yeah.
I had 4 goats for a couple weeks, and because I was clearing out some property.
So you just get them to kind of lawn mow.
Oh yeah, exactly. We just put up an electric fence around them that's mobile, and then you just let them go. And instead of cutting it with a bush hog or piece of machinery, you just let the goats eat everything. And I'd come back, a day later where I left them, and 400 square feet would be eaten. I'm like, I got to move you guys again. So I'd have to move them to the neck, and it just got too work intensive to keep rotating them. I had to send them back to the farm that I borrowed them from.
Yeah, you got to keep feeding. There's not grass can't grow quick enough. Okay, that answers my question. Should I get a goat? I don't think I have enough land.
But they are super cool. They're super cool animals.
Yeah, they're fun.
But they will eat everything as soon as they'll start eating your whatever you got on your wrist or your pants or whatever. They're grabbing everything. Then out of nowhere they just ram you. And I've had someone get injured, not someone that works for me or anything, but I know somebody. They're around a goat. The goat just whammed their knee, tore their meniscus.
Oh my goodness.
Yeah, I'm like, dude, you got to be careful around these things,
Yeah, they're wild cards.
Exactly, but they're super cool. Super cool. So, but yeah.
Ending this on a goat, I love it.
There you go. Well, thank you again, Doc.
Appreciate it.
If you guys need to reach out and get your dog checked out, can you give us your info?
Yeah. So Jake Jacobson is my name. I've got a hospital called Charleston Veterinary Cardiology. We've got an Instagram page, websites, all Charleston Veterinary Cardiology. So,
do you happen to have a network? Because we have a lot of listeners that are all over the country. Is there like a place that they can go to find a cardiologist in their area? Like
yeah, it's called vetspecialist.com. So if you need a vet specialist, if it's a internist or an oncologist, vetspecialist.com. You put in your zip code and it shows you who's around you, who's nearby. That's the way you find us, guys.
Awesome.
Yeah.
Well, thanks again, Doc, and you guys take care of your dogs. Get them good to go.
Appreciate it.
And with that was a good discussion with Dr. Jacobson, cardiologist, canine cardiologist. So a lot of information that we learned on that one, and there's always more to learn when it comes to our dogs, their health, what we can do to help them live their best life possible, and continue to help them, be healthy throughout the duration of their life. And it starts at the beginning, having those preventative measures that we talked about. So I know I'll be listening to this episode a couple times just to try and absorb all the information possible that Dr. Jake has to share, and very much appreciate his time for coming on the podcast. But as we wrap this up real quick, just going to talk about some of our affiliates. Of course, we have Canine Revolution Dog Training. We have board and train programs. We have private lessons. We have virtual lessons. If we can support you and your dog, just let us know how we can do that. We also have Canine Revolution apparel that's on Amazon. So if you want to get a Canine Revolution logo hoodie or a logo shirt or a good to go shirt, that way you're always good to go. You can go to Canine Revolution apparel on Amazon, grab you one of those. Make sure you get the right size, right? If you're looking for a hoodie, I recommend our heavy hoodies on Amazon. We have a bunch of different hoodie versions. We're going to consolidate those a little bit from some recent feedback. But we have the fitted hoodies that are a little bit tighter. Then you have the heavy hoodie, which is more of your like normal sized hoodie where it's kind of loosey-goosey on you, right? So you can go to Canine Revolution Apparel on Amazon, check all that out, get what you want, support yourself, support the podcast, support your friends and family by getting them hooked up, and everybody will be good to go. Our next affiliate is We Feed Raw. So on the podcast today, we talked a lot about diet considerations. Some of the things that stood out to me based on our discussion are those amino acids that our dog needs to support the muscle mass on their body. Your heart is a muscle, your dog's heart is a muscle, so you definitely want to have the optimal diet for your dog to support their body, to support their muscle mass, to support their organs. And there's honestly no better way to do that than We Feed Raw. You can go to wefeedraw.com. You can use the discount code Canine Revolution. That's going to be all caps, no spaces, spelt out, Canine Revolution. That gets you 25% off your first meal plan. And We Feed Raw has now expanded their line of products. So they have their traditional raw food where you have to have it frozen or refrigerated. They ship it to you frozen, and all this gets shipped to you. They now have freeze-dried raw. So it's easier to store, it's easier to handle. Comes in a bag just like kibble would, but it's way better than kibble, obviously, because it's freeze-dried raw. So you can set that up on the We Feed Raw website. Now, We Feed Raw does use subscription plans, so you have to put in your dog's info, set up for a subscription plan, but you can cancel it at any time. You can pause it at any time and, kind of mix and match your products on there. They also have raw treats that you could use with your dog. Those are dehydrated as well. But I got all my dogs on the red meat-based food plans. They've got the beef, they've got the lamb, they've got the venison. My dogs love the venison, all sourced in the United States. And I think they source some of their meat from New Zealand, but the rest of it is from the United States. And, so there's no better way than to have a PhD nutritionalist that's designing these formulas for your dog for their health long term. Now, it is going to be a little bit more expensive than your traditional kibble diets because the kibble diet is a processed diet, obviously not good for your dog. So you get them on a We Feed Raw. I honestly, truly believe this is going to help you and your dog's longevity. I have 3 dogs. One, Sarabi, she's the first patient that we took, or the first dog that we took to Dr. Jake. And she has heart disease, right? She has a valve that doesn't work properly in her heart. We put her on the raw food. We did our next year assessment, and it looked like there were some improvements in her heart based on what he was saying. So that's one reason that I know that the raw food does help. Of course, she is on some pharmaceutical help from Dr. Jake and what he prescribed for her, and that helps as well. Then I have my Doberman Bane. Whenever Sarabi was having her heart issues, and we put her on raw food to try and help her, we put him on raw food too. He went in for his heart assessment, and he had a clear bill of health. So I truly believe, raw food's going to help you do that from a longevity standpoint. Unfortunately, the rest of Bane's litter mates, they've all passed away, most of them from a heart-related problem, and his heart checks out. So that kind of gives an indicator that the raw food does definitely help us out with that kind of stuff. So one thing I'm going to be doing is whenever I travel with my dogs, put them on the freeze-dried raw, so I don't have to carry around a bunch of refrigerated or frozen raw meat patties or meat packets. I can just have that freeze-dried raw, feed them that while we're traveling. When we come back home and we're in our normal routine, I'll feed them the raw. All right, so check that out, wefeedraw.com. Our next affiliate is Canine Super Supplements, the letter K, the number 9, supersupplements.com. They've got a number of powdered supplements for your dog. They've got weight gainer, they've got multivitamin, they've got joint support, they've got puppy formula. So these formulas are designed to mimic a raw diet. And so they have things like beef liver in them. They have bone marrow in them. They have, powdered coconut milk, powdered pumpkin. They have powdered bone broth, which is going to provide that collagen to your dog. All powdered, very easy to give to your dog. So if you can't do raw food for whatever reason, maybe it's too hard to handle for you, maybe it's too expensive for you, these are a great thing to incorporate into your dog's kibble. to bring up the level of nutrition that you're giving your dog. And they have a ton of protein and amino acids in there. So again, we're hitting that checkbox where we're thinking about our dog's heart health long term, our dog's muscle mass long term for their longevity. So providing a good supplement like Canine Super Supplements helps to meet those goals. So go to caninesupersupplements.com, letter K, number 9, supersupplements.com. Use the discount code Canine Revolution, all caps, no spaces. That gets you 15% off your order. What I recommend for most people, get the joint support, get the multivitamin. Those are great starting points. Incorporate those into your dog's food. If your dog is a little bit on the leaner side, maybe it needs to gain some weight, you can add in the weight gainer. And if you just want that extra level of supplementation, you can add in the puppy formula as well. The puppy formula specifically has powdered goat milk in it, which is a great source of nutrients for your dog. So check that out. Add it into your dog's food. You will see results from that. At Canine Revolution, we're training a bunch of dogs. If we have a dog that's down on their weight, we add in weight gainer to their kibble. And, because you could just add in more kibble, but that's just more processed food. It's not very bioavailable a lot of times. So you add in that weight gainer, boom. Now you're giving them a super supplement. That's why it's called Canine Super Supplements. All right. Next up, we got Jocko Fuel. So, of course, we want to support our dogs. We got We Feed Raw. We got Canine Super Supplements, but we also need to support ourselves. That's what we have Jocko Fuel for, right? So we have the Jocko Go, which we left a couple with Dr. Jake. That's your clean energy drink. We've got the Jocko Hydrate, which is going to get you your electrolytes and your electrolyte mixes. They've got a number of supplements on there. So check out jockofuel.com. Definitely get on that fish oil. We talked with Dr. Jake about adding in some fish oils or salmon oils to your dog's food for their heart health. And we talked about, hey, you could take that too. Or you could give your dog a human-grade fish oil supplement. But if you go to jockofuel.com, you get the Jocko Fuel fish oil for you. Take 2 capsules a day. That's going to get you where you need to be as far as your omega-3 fatty acids. So don't get me going on a tangent here, but that's going to help you support yourself. Go to jockofuel.com. Use the discount code Canine Revolution, all caps, no spaces. That gets you 10% off your order. So thank you again to Dr. Jake for taking the time to speak with us. Thank you for listening. If you're watching on YouTube, don't forget to subscribe to us. If you're listening on your favorite podcast platform, don't forget to rate us, review us. That definitely helps us beat the algorithm, trying to get this information out there, trying to help you, trying to help every dog owner out there live the best life they can with their dog. If we can support you in any way, or if you can think of a podcast topic that we haven't covered that you need us to cover, just reach out. Let us know on your favorite social media platform. And until next time, this is Pack Talk Podcast, out.